I want to get into TRT a little bit. So, testosterone replacement therapy. It's like so overwhelmingly popular right now. And I have so many guys coming in. And I was really discouraged as a young doctor to go into that because of the dangers of it. I know you guys do TRT. Can you talk a little bit about maybe it in general? Your approach to what kind of a guy is a candidate, what kind of guy should be worried about it and consider it? I know it's a really broad question, but kind of maybe a jumping off point.
You just said about the sort of dangers of it. And I think a lot of that is born out of now, as I say, it's like 7-Eleven, there's one on every corner. Everybody's doing it. A lot of these facilities are not owned or led enough by doctors. So they're coming at it from a business standpoint. Look, we're business people. I get it. But I always say it's medicine first and it's business second. Business might be a close second, but it's second to medicine and the patient in front of you. So if those kinds of clinics that are now all over the place, it's becoming more popular, it's diluting the real message of optimization and being careful and medicine. So I think that's created some of those things, if that's in fact what you meant. Then there's just, yes, there are inherent dangers. Yes, there is almost in anything in medicine, potentially. We screen out for all of those kinds of things, whether that's thickening of the blood or of course, we're screening the prostate up and down and making sure that we're being careful about who is the best candidate. So to answer to that portion of your question, yes, you have to screen it very correctly. The person who's likely the candidate is someone that's starting to say something's different. We were just talking about this just a little bit ago, that patients, both men and women, will say something's missing. I don't know what it is.
Right.
It's like this abstract kind of thing that comes up. And then when they get well, they'll say the same, something's better. I don't exactly know how to say it to you, but it's just better. And so, yeah, I know you know what you've heard that, but I'm sure many times.
It's
So
almost like that's pathognomonic for testosterone replacement. It's almost like that's one of those very unique presentations to a low, especially if they're just low normal testosterone patient, where they don't feel amazing, they don't feel their best, or the symptoms they're feeling are disproportionate to the stressors in their life. And then when you see them feeling better, like John's saying, it's like, I don't know what it is, I just feel better. So yeah, and the range of people who are candidates for testosterone, I would say, are broader than those that I mean, I think if you're meeting the patient with awareness, then it's not so much about danger. You're aware of what are the things that we need to look for. What is their hematocrit, their hemoglobin, what are, those kinds of things, because it's a pretty broad range of candidates.
it is. And again, so maybe the basics, the fatigue, low libido. I mean, we say, the reason we've coined the term the sex docs is not because we just necessarily thought about it, but it's because what happens, patients come to us because they want two key things. They want more sex and they want more energy. We've just seen that. So it's like this metabolism zest for life is what they're looking for. So a lot of times when people have those issues, that might be the candidate. Hey, something's off here from my sexual wellness standpoint. It could be actual erectile dysfunction. It could be mild forms, and there's many different sort of iterations of that for guys. Something's just off when it comes to their libido, means psychological desire and drive to want to have sex. All of that starts to shift and change, and that might be time to knock on the door and look for someone that's going to, be accurate in how they're going to assess.